Hello, my name is Miguel Mendez, and I'm going to introduce you to Group 7 scenario. Firstly, I want to introduce our awesome team. We have Stephanie Lodaros, Nakia Taylor, Madison Hake, Jody Therion, Heather Habis, Crystal Mixon, and Ashley Gallion, and once again, my name is Miguel Mendez. Our scenario introduced us to an 87-year-old female who's a widow. She's been living with her daughter for the last 5 years since her husband passed. She was a direct admit from her primary care provider's office with complaints of shortness of breath and urination frequency is followed with a burning sensation. Currently, she is experiencing an exacerbation of her COPD, followed by hypertension, pneumonia, UTI, heartburn from her GERD, and hypokalemia, according to the scenario's information. She was in the hospital for the last 5 days and was discharged by her doctor. Now, as we know, this is a brief overview of our scenario's information. We did record a short skit that we would like to play for you, displaying a short run-through of the errors, omissions, and patient teachings we found. Now, I just want to remind you that due to our time constraints, we will only be sharing a few of these errors, omissions, and patient teachings. Disclaimer. Within this skit, you will see a nursing team and a doctor taking care of a patient. This is only a reenactment of a false scenario. Hence, the nurse thinking she is better than the doctor and the doctor allowing it. We hope that you enjoy our skit, and in advance, thank you all for your time. Hi, Miss Loco. How are you?
Good. How are you?
Very well. My name is Dr. Mendez. This is Nurse Nakia. She's going to assist me in your care. Before we start, can you please verify your name and date of birth? Let me borrow your wrist, sweetheart.
Virginia Loco, 10-3-27.
Okay, thank you. Is this your daughter?
Yes, this is my dear Coco.
Hi, Coco Loco. Nice to meet you. We're going to take great care of your mother here, okay? I'm just going to talk to Nurse Nakia about what we've got going on for you today, okay? So, Nurse Nakia, we have an 87-year-old Miss Loco. She's here because she has an exacerbation to her COPD, as well as hypertension. Her blood pressure when she came in was 162/94. She's also found some fluid in her lungs, so we're suspecting pneumonia. Also has a urinary tract infection, which means that her kidneys are having some problems, as well as some heartburn from her GERD. And she came in with hypokalemia. Her numbers for her potassium were 4.9, so I'm just going to continue the potassium chloride.
You are?
Is there a problem?
Well, I know for a fact that 3.5 to 5 is the normal range for potassium. 4.9 is pretty high, doctor.
You're absolutely correct. I'm sorry, Miss Loco. I'm sorry, Miss Loco.
I'm old, not deaf.
Oh, I apologize. What we'll do is hold and monitor her levels, okay?
Sounds good.
Thank you.
Thank you, nurse. Looking out for you, Miss Loco.
Apparently. Continuing with her stats, she is measured at 64 inches tall. She weighed in at 173 pounds with a BMI of 29.7, classifying her as a normal weight.
Nope.
Nope what?
That's wrong too, doctor. She's actually classified as overweight. Wait a second. Sorry, Miss Loco, I'm just baby weight.
I'm sorry, Miss Loco. I can't really disagree with her. She's absolutely correct. My numbers were wrong in my head. 29.7 does put you at an overweight, but we can take care of that with some diet changes. Please do not worry, okay? Don't worry, it's not really the baby weight to it. So what we're going to do then is I'm just going to go ahead and order for you to start her on 2 liters per minute of oxygen via nasal cannula.
What was her O2 stat before that?
I'm sorry. I apologize. We're trying to take really good care of you, but it seems like we have yet to have gotten your O2 stat. What we'll do is we'll go ahead and hold off on that. Give me the O2 stat, and I'll tell you exactly where we need to be.
Right away, doctor.
Thank you.
Bye, Miss Loco.
So, Miss Loco, it seems like you're doing pretty well now, looking at all your labs and everything. What we're going to do is set you up for discharge. Alright, before we do that, we want you to learn how to use your nebulizer and learn some things about certain of your medications before we let you go. We want the safest thing for you, alright? So what I'm going to do is I'm going to welcome Miss Stephanie and Miss Heather to come talk to you about some stuff, alright? If you need me, just let me know. We'll be back to talk to you, okay? Thank you.
Hello, Miss Loco. How are you doing today?
Good, how are you?
Hi, how are you doing?
Good.
All right, well, my name's Stephanie, and I'm going to be teaching you about your nebulizer. Have you used this at home before?
Yes.
Okay, so hopefully this will just be a little bit of a review. This is the machine, and you'll be using your DuoNeb. You'll attach the mouthpiece here, and the other portion here. You want to make sure you keep it in the upright position. This comes on. You'll open your DuoNeb, pour the solution into the chamber. Attach this on top. Again, keep it in the upright position. And when you turn it on, you'll see the steam come out. So you'll just want to breathe on this end. Let it keep going. Breathe on this end until all the solution is used.
All right.
Do you have any questions?
No.
All right then.
Thank you.
I'll let you speak with Heather.
Thanks so much, Stephanie.
You're welcome.
So I didn't catch her name.
This is Coco.
Oh, Coco Loco. Very interesting. So the doctor has ordered some new medications for you. Some of them that you're on at home, he's still going to leave those orders the same too as well. The Verapamil is the one I'm going to go over with you right now. Do you know what you were taking that one for?
I think for my blood pressure.
Yes, it is for your blood pressure, okay? He did change the milligrams on that one, okay? You're actually going to be taking that one twice a day now, so you're going to take one in the morning and one at night. It's every 12 hours, okay? We've made a schedule for you of that medication as well as the other medications that you were on at home too as well. Nicely timed out. I'm going to leave this here for you to review and everything too as well. With that Verapamil, make sure that you don't cut that tablet in half, okay? Just one in the morning, one at night. So if you get up in the morning at 7 o'clock, 8 o'clock in the morning, and that's when you take your medications, it'll be 7 in the morning and then again at 7 at night, okay? One thing that we want you to be aware of with this is we're going to teach you how to monitor your beats per minute, okay, your pulse rate. And that needs to be at least 60, okay, to take that medication. We don't want your heart rate to be under 60 beats per minute, okay? Have you ever taken your pulse before?
Yes.
You have? Okay, well that's really good, but what we'll do is we'll just go over it with you again too as well, make sure that you know how to do that. Again, we'll have you demonstrate the nebulizer treatment back to us. We'll watch you do it and make sure that you're using that correctly too as well, okay? So I'm going to leave you the schedule here to look over and review. I'm going to go get the rest of your discharge paperwork, okay? And then I will be back, okay?
Thank you.
All right, thanks. Bye, Coco Loco.
Hi, Miss Loco. It's me, Dr. Mendez again. How are you?
I'm good.
Good. You look very happy. You're going to get out of here soon.
Yes.
Awesome. So this is Nurse Matt.
Hi.
She's going to go over some last and final information before we send you home. I just wanted to come in and thank you again for allowing us to take care of you. Miss Coco, it was a great pleasure to meet you. You take care of yourself.
Thank you so much.
Bye now.
How you doing, Miss Coco? I'm good. I think that you're feeling much better since the time that you come in. Is that correct? Yes. Okay. So I did notice that the doctor gave you 500 milligrams of levofloxacin, and you're supposed to be taking that for 10 days. Okay. Since you have already taken that for 5 days, we need to make sure that you continue to take that medication as soon as you come home. So even though you're feeling much better, it's still going to make sure that you don't get the pneumonia and the UTI symptoms that you have when you came in. Okay. Do you understand all of that? Yes. And do you have any questions for me? No. Okay, and can you repeat what I just said to you? Yes. My antibiotic, the levofloxacin, I'm going to take it until I run out, even if I feel better. Wonderful. And is there any questions that you have, Miss Loco? No? Okay. Thank you so much. Thank you.